Hi guys, my name is Morgan Gott and I am a student at the University of Kentucky, and this is my PowerPoint. I did my project on fall prevention. My practicum review. During my clinical rotation, I did mine at Eastern State Hospital in admissions. I am actually a registered nurse there. So I was very familiar with how things worked on the unit, but I was not familiar with how things worked from admissions standpoint. So I followed around a nurse who I get to work with actually quite frequently on the units, but she does a lot of shifts in admissions. And we spent a lot of time going over the legal process, what criteria patients must meet in order to be admitted to the hospital. A lot of them come in on petitions, some present voluntarily, and so we really went through the steps of that. Then I got to see how they work really one-on-one with the physician and the patient, and they put the chart together. We're all paper, so everything is pretty much done in admissions. The physical assessment, the psychosocial, everything, the nursing assessments, the head to toe physical, all that's done in admissions. So it was really cool to see that side of things versus really just like assessing someone from their, mental standpoint. So that was really interesting to me. I decided to do my project on fall prevention through identification of fall risk factors and early fall prevention interventions and admissions. So I created a 5-question post-test pre-test, and then the same questions for the post-test, in a form that had like factual information about how to prevent falls risks. And then once people saw the fact sheet, then they took the post-test, and I was seeing if there was an improvement at the end, and what the importance of recognizing fall risk in patients in admissions, and if that decreases falls on the units. My learning goal: understand the risk factors for falls, understand how falls can be prevented, assess whether an intervention is effective. Is that educational handout beneficial to reducing the number of falls within an organization? My plan was to create a fact sheet for employees and identify the risk factors for falls, and then test their knowledge with a 5-question quiz. Implement the hospital practices to reduce falls, so Eastern State's normal fall, practices. Assess whether the fall numbers decrease across the hospital. My learning objectives were met for this project. I accomplished this goal by creating a fact sheet for all staff members in admissions and administering a 5-question pre-test and post-test. Post-test scores on identifying fall risks and fall prevention increased after receiving the handout. The staff members in admissions understood the risk factors for falls and the importance of recognizing a falls risk in the initial nursing assessment, so trying to prevent falls once the patient reaches the unit. It was kind of hard to really get a lot of data because the time spent in this clinical rotation wasn't really enough for a full study. I really kind of worked with the same people, so there wasn't really a wide variety of people I could really administer the post and pre-test to. If I had a longer time, which I can do in my own time as an employee there, I can implement it onto the units and really collect data that way. My implementations, there's a bunch of them. Each patient will be assessed for fall risk at the time of admission. This helps identify fall risk factors and early fall prevention for when they are transferred to their unit, ultimately reducing falls among the hospital. Fall risk assessment will be performed daily and with each fall, which that's already a standard practice at Eastern State. If a patient is found to be a fall risk, they will remain a fall risk for the rest of the time at the hospital per physician. There are very small cases where that is actually where patients can be removed from a falls risk. Once identified as a fall risk, a PRP falls focus is opened. At Eastern State, a red armband is placed on the patient, a leaf up on the side of their door, non-slip red socks. Their shower is turned off. A safe unit environment is maintained, uncluttered rooms, good lighting, address vision problems. Do they need a walker? Do they need to be on one-to-one, like a close observation? Staff needs to understand the risk factors for falls, and staff will remain in compliance with trainings. The pre and post test, East employee and admissions will get this. The average pre-test scores were 88.5% and the average post-test scores were 97%. I only got to administer this to 7 employees. This is you can't really see it, so I'm going to attach the full PowerPoint below. There's 5 questions. These are the documents. This is the handout I created, and this is actually the fall assessment tool that is done on every single shift on the units. Post-fall evaluation and care. Patient is assessed and treated for injury and moved to a safe location if they do in fact fall. The MD is notified, documentation of the fall, and the fall protocol is initiated. And then this is the sheet, fall scene investigation report that's actually done on if a patient does fall at Eastern State. Fall data. So this is the total falls to date at Eastern State and why they fell, like environmental, mobility, physiological, were they self-reported, unwitnessed, witnessed, where they were located of falls, and how many falls were done by each unit. And there actually have only been 2 falls in admissions. My practicum experience, I got to witness interprofessional teamwork and effective communication, which went hand in hand with what we were reading in the literature. Communication and interprofessional teamwork skills are a huge part of the protection from injury and complications that nurses provide for patients. Safety is drastically enhanced when the communication center uses clear, precise communication and provides an opportunity for clarification. When my preceptor and I admitted a patient, we were utilizing interprofessional teamwork by working with every member of the healthcare team. So with our readings, I really got to see interprofessional teamwork, effective communication skills, the SBAR technique when handing off communication is like the main thing they use, from the nurse that's in admissions giving all the information to the physician when they first assess a patient. So the nurse sees the patient first, and then the physician goes behind and does a full workup once they're admitted. Then that nurse goes and gives all the information to whatever charge nurse is on the unit that the patient will be transferred to. So SBAR is really used quite frequently in admissions, and that went hand in hand with the reading. Effective communication, everyone has to work together to get those patients admitted onto the units. You don't want them sitting long in admissions. Patient safety, quality care, high reliability organizations, everything that we learned in the literature was a part of my clinical experience. Best practices in fall prevention focus on identifying, addressing risk factors for falling, and then implementing interventions to reduce those risks. So, older adults are high at risk. So, education, ask about history of falls, conduct a risk assessment, gait and balance problems, advise patient participate in regular physical activity, endurance, balance, medication issues, identify and reduce the number of medications, conduct frequent reviews of meds, and check blood pressure. A lot of falls can be due to blood pressure medication. Their blood pressure drops, they get dizzy when they stand up. Are they on too many meds? Are they kind of sedated? Are they a little out of it? Visual impairment, make sure that they have routine vision care or wearing their glasses. Environmental hazards, water on the floor, stuff like that. And Eastern State, everybody is up to the best practices for fall prevention. Reflection, overall, I've learned a lot from my preceptor. She did a phenomenal job at helping me gather information and data on falls within the hospital. She showed me the process in admissions, which was a lot. I learned a lot. Our readings about interprofessional teamwork skills and communication really helped me notice how well the team works together to admit patients and get them to the units, with the important information communicated from one healthcare provider to another with the SBAR technique. Without the effective communication from all members of the healthcare team, the patient would suffer and more errors would occur. I've really enjoyed this rotation in admissions at Eastern State, and I retained a lot of knowledge that will help me move forward with my nursing career. I enjoyed seeing a completely different side of the hospital that I have worked for almost 4 years. I appreciate the process that goes into admitting a patient from the legal standpoint and the assessment standpoint. In my personal experience during this practicum, I feel as though I was utilizing more nursing skills and admissions than I do on the unit, and I really enjoyed working up the patients and doing the full medical and psychosocial assessments. These are my references, and that's it. Thank you, guys.